Thank you, Dean Delaney. I stand here at this podium all by myself. But like all of us graduating today, I did not get here by myself. To our spouses, our partners, our parents, our children, our siblings, our friends who stood with us throughout our arduous journey, I express deepest gratitude for your encouragement, support, and patience. To our professors, clinical instructors, and teaching assistants, thank you for educating, mentoring, and shaping us into the professional nurses that we are about to become. Your ceaseless commitment and dedication to the field of nursing is an inspiration to us all. To my fellow graduates, the PhD, Doctor of Nursing Practice, and Master of Nursing programs, I say congratulations. The nursing profession is a hallowed one. As nurses, we are afforded the privilege of being present in the most intimate spaces in people's lives. Some of us will care for the newest human beings who have just taken their first breath. Some of us will attend to those who are about to breathe their last. Some of us will attend to those but every one of us will work with an individual, family, or community that is experiencing some form of suffering that inevitably arises from the fact that we occupy a physical body in a physical environment. And as nurses, we are called to diagnose and treat the human response to these realities. And we will. We will show up in the hospital, the clinic, the home, a bit uncertain at first about our readiness to assume this awesome responsibility. We'll find ourselves needing to do a quick mental refresh on electrolyte balance or medication interactions. We may come to the end of a grueling shift questioning the wisdom of our decision to become a nurse in the first place. Whatever uncertainties or misgivings we may have, however, we must never forget on whose shoulders we stand and in whose footsteps we walk. The path of all nurses is perpetually lit by the lamp of Florence Nightingale. However, many lesser-known figures are worthy of our recognition and reverence for their part in opening wider the doors of the profession. To mention only a few worthy notables in this country, there is Mary Elizabeth Mahoney, the first African American to study and work as a professionally trained nurse. Susie Walker Bear Yellowtail, one of the first Native Americans to graduate as a registered nurse. Leroy Craig and Joe Hogan, whose tireless advocacy and legal action helped pave the way into the profession for men. The responsibility now falls on us to hold that same door open so that LGBTQ people may continue to walk through. Those of us who traveled together as an MN cohort for the past 16 months, we have survived. We survived phys and pathophys. Some of us emerged from Dr. S's office hour sessions with a clearer understanding of the material taught in lecture. Some of us, well, not so much. For some of us, essentials of holistic assessment was as easy as riding a bicycle. For others of us, the bicycle was on fire, we were on fire, and everything was on fire. Some of us got 100% on the final med-calc exam. The rest of us got a tongue lashing from Mary Ron. But the one thing I'd say we are all together on is this. The idea of the coherently structured group paper is oxymoronic, and it has got to go. It is an honor to be a member of the Master of Nursing 2018 graduating class. We agitated and complained when we saw the need for change. We've had 2 births and another baby on the way. We worked together, we did our best, and we are here today because we did what? We trusted the process. Again, to family, friends, and faculty, thank you. And to the class of 2018, congratulations.